Have you ever wondered what happens inside our bodies when we get a small cut? For most of us, the bleeding stops quickly. But for some, it's a much more complicated story. Welcome back to our channel. Today, we're diving deep into the world of hemophilia, a rare but significant blood disorder, to understand its complexities and the incredible advancements in its treatment. So, what exactly is hemophilia? In simple terms, it's a genetic disorder where the blood doesn't clot properly. Imagine your blood has a team of first responders called clotting factors. When there's an injury, these factors rush to the scene, working together to form a plug or a clot to stop the bleeding. In people with hemophilia, one of these key responders is either missing or doesn't work correctly. This means bleeding can last much longer than usual. There are several types of hemophilia, but the most common are hemophilia A and hemophilia B. Think of them as different players on that first responder team. Hemophilia A is caused by a deficiency in clotting factor 8, while hemophilia B is linked to a lack of clotting factor 9. There's also a rarer form, hemophilia C, which involves factor 11. The type of hemophilia a person has determines the specific treatment they'll need. Now, you might be asking, how do doctors figure out if someone has hemophilia? The diagnostic journey is a fascinating piece of medical detective work. It usually starts when someone shows symptoms like frequent large bruises, unexplained bleeding from the nose or gums, or prolonged bleeding after a cut, surgery, or dental work. For infants, a key sign might be excessive bleeding after circumcision. When these symptoms raise a flag, doctors turn to specific blood tests. These aren't your typical blood counts. They are specialized screening tests that measure how long it takes for blood to clot. If these initial tests are abnormal, the next step is a clotting factor assay. This test directly measures the levels of specific factors, like factor 8 and factor 9, in the blood. The results not only confirm the diagnosis of hemophilia but also tell us its severity, mild, moderate, or severe, based on the amount of active clotting factor present. A person's family history also plays a crucial role. Since hemophilia is a genetic condition, it's often passed down through generations. A doctor will ask detailed questions about whether relatives, especially on the mother's side, have had similar bleeding problems. This helps to piece together the genetic puzzle. However, it's important to know that about 1/3 of cases occur in families with no previous history of the disorder. This happens because of a spontaneous genetic mutation. To get the most precise picture, genetic testing can be performed. This advanced testing can pinpoint the exact mutation in the clotting factor gene. Knowing the specific mutation can be incredibly helpful for family planning and for predicting how severe the condition might be. Early and accurate diagnosis is absolutely key. The sooner a person knows they have hemophilia, preventing complications like joint damage from internal bleeding and leading a fuller, healthier life. So, once a diagnosis is confirmed, what's next? The cornerstone of hemophilia treatment for decades has been factor replacement therapy. It's a very logical approach. If your body is missing a specific clotting factor, the treatment involves replacing it. This is done by infusing a concentrated form of the missing factor directly into the person's bloodstream. These factor concentrates can be derived from human plasma, or, more commonly today, created in a lab using recombinant DNA technology. This therapy can be used in two main ways. The first is on-demand treatment, where the infusion is given in response to a bleed to help it stop. The second, and often preferred method, is prophylaxis, or preventative treatment. This involves regular infusions, maybe 2 or 3 times a week, to maintain a constant level of clotting factor in the blood and prevent bleeding in the first place. Prophylaxis has been a game changer, especially for children, as it helps protect their joints from the damaging effects of repeated bleeds. But the world of medicine never stands still, and the landscape of hemophilia treatment is evolving at a breathtaking pace. We're now in an era of incredible innovation with new therapies that offer more convenience and long-term solutions. One exciting development is non-factor replacement therapies. These are medications that work in different ways to help the blood clot, essentially mimicking the function of the missing factor, but without replacing it directly. Some of these can be administered through a simple injection under the skin, rather than an IV infusion, and they last much longer in the body, requiring fewer treatments. This is a huge improvement in the quality of life for many patients. And then there's the holy grail of genetic disorder treatment, gene therapy. This is where science gets truly futuristic. The goal of gene therapy for hemophilia is to provide the body with a new working copy of the faulty gene. This allows the person's own body to start producing the missing clotting factor. Several gene therapies for both hemophilia A and B have shown incredible promise in clinical trials, with some patients achieving normal or near-normal factor levels after a single treatment. While it's still a new and complex field with long-term effects to be studied, gene therapy holds the potential to be a functional cure, freeing people from the need for regular infusions altogether. Regardless of the specific treatment, continuous care is vital. Living with hemophilia is a lifelong journey that requires a comprehensive approach. Regular monitoring by a specialized healthcare team is crucial. This team often includes hematologists, pharmacists, nurses, physical therapists, and social workers, all working together at what's known as a hemophilia treatment center. They help manage the condition, adjust therapies as needed, and address any complications that may arise, such as joint problems or the development of inhibitors, which are antibodies that can make factor replacement therapy less effective. Living with a chronic condition like hemophilia presents daily challenges, but it also fosters incredible resilience and a strong, supportive community. Knowledge is power, and understanding the science behind the disorder, the diagnostic process, and the ever-expanding treatment options is the first step toward empowerment. The future for individuals with hemophilia is brighter than ever before, thanks to medical research and the dedicated healthcare professionals who support them every step of the way. Thank you so much for joining me on this deep dive into hemophilia. I hope you found it insightful. If you learned something new, please give this video a thumbs up and consider subscribing for more content that unravels the amazing world of science and medicine. Disclaimer: this content is for educational purposes only and should not replace medical advice. Stay curious, and I'll see you in the next video.